cancer is a cancer of blood cells, and there are different type of blood cells like red cells, white cells, and platelets. Most of the patients with blood cancers will be having cancers of white blood cells, and depending on the type of white blood cell, that particular cancer is classified. Cure is possible in many subtypes of lymphoma, because lymphoma is not a single disease. There are many subtypes, and if you broadly divide lymphomas, they are Hodgkin's or non-Hodgkin's. And in non-Hodgkin's, again, it can be divided into aggressive and indolent, means slow-growing or fast-growing lymphoma. So many of the fast-growing lymphomas are curable because treatment what we give acts better on fast-growing cells. So many of the aggressive lymphomas are curable. I think this is very vague sentence, because anemia is just low hemoglobin, and many blood cancer patients do have anemia, but anemia itself cannot cause cancer. For majority of the patients, we don't know why lymphoma happens. We only know what happens inside the cancer cell, and that is some genetic alteration in the cell's DNA, and that leads to uncontrolled proliferation of these cancer cells. But this is not hereditary. It cannot be passed on to the generation. Of course, there are some situations like some immune defect or defect in immune system which can run in generations, and that can make person prone to get lymphoma, but it cannot be passed through generation. So it is not a genetic disease. Yeah, so there are certain subtypes, particularly slow-growing lymphomas, which happens usually at older age, and in family, one person has it, so other person will be having slightly higher chance of getting it, but those chances are slightly higher when you compare to normal population. So 1% to maybe 2%, not more than that. Tuberculosis and lymphoma are totally different disorders. Tuberculosis is an infection, while lymphoma is a cancer. TB cannot lead to cancer, but the problem is often they are confused with each other because they might have similar radiological or scan findings, similar symptoms like fever, weight loss, etc. And this confusion can only be removed when you actually take out the tissue and do the biopsy and do the proper examination. It is not safe. Bone marrow transplant is helpful in curing many of the blood cancers, but as we have already discussed, that blood cancer is not a single disease. There are many subtypes, and use of transplants is limited to few subtypes, and mainly it is useful when your cancer comes back. Many of the cancers now can be treated only with oral tablets as well. So transplant is not must for all the blood cancer. So herbal medicines are offered to many patients. They go to these alternative medicines mainly when there is no hope from modern medicine or evidence-based medicine. But till now, I don't think there is any evidence that herbal medicine or any other alternative medicines helps in curing any form of cancer. Depends which kind of lymphoma you have and what treatment is being offered. So most of the lymphomas are treated with combination of chemotherapy and targeted treatment. And this therapy usually lasts for 6 to 8 months. During this 2 to 3 days after chemo till maybe 1 or 2 weeks, patients do feel weak, but most of them are not absolutely bedbound, or they do have good performance status, and usually they are able to perform daily activities. Yeah, so we have seen lots of advancement in cancer and in general in medicine. Every few years we get some new therapy or new drugs to treat these lymphomas, and day by day the treatment is getting better with good response rate and with very less side effects. And one thing we need to know, that whatever is available in Western world is almost everything is available here. It might take 6 months to 1 year extra to reach us, but almost everything can be done in India now.